Good afternoon, everyone. My name is Laurie Gagan, and I am the founder of StopSprayingGlyphosate.com. Today, I am honored to be able to interview one of my dear friends and colleagues, Dr. Richard Fleming. Dr. Richard Fleming is a PhD, an MD, a JD, a physicist, and a nuclear cardiologist. He has over 55 years of research, which has made him one of the top doctors in the world, educating about heart disease and inflammothrombotic response disease. Dr. Fleming has been investigating into the origins of SARS-CoV-2, which has resulted in uncovering of gain-of-function research that has occurred over the last 2 decades. You can find more on his work at 10letters.org. Dr. Fleming will be presenting at the 2023 Vitamin C Conference, September 14th through the 16th, 2023. There, he will be explaining the 9 pathways activated by the virus SARS-CoV-2 and the disease COVID. More information and registration can be found at https://www.vcici.org/conference/. And now I'd like to introduce you to my dear friend and colleague, Dr. Richard Fleming. So it's always good to see you, my friend. Let's go ahead and get started. We are going to be talking about your upcoming Vitamin C conference. I know a lot of people like to say vitamin, but you always correct me when I'm wrong. It's vitamin. So, Dr. Fleming, you're going to be speaking at the upcoming Vitamin C conference, which I know is one of the most important antioxidants in the body. So I'd like to ask you a few questions on how vitamin C, pertains to some of the turbo cancers we are seeing an uptick on, and how vitamin C helps our body. So if you're ready, I'll start with the first question.
It's all yours.
Great. So can you explain to our listeners in a way that they can understand what is inflammothrombotic response disease?
Okay, well, we've talked about inflammation and heart disease and a variety of diseases for decades. And the whole concept was this was a simpler term to use, kind of like blood thinner, right? Except that blood thinners don't thin your blood. They prevent your blood from clotting. And the whole concept about how your body, your immune system, reacts to something coming into it that shouldn't be there is a combination of chemicals and reactions occurring inside the body that cause inflammation or swelling and blood clotting. And they're both critical, but we just haven't put the terms together. And you know, I think people are intelligent enough that if we just simply say inflammothrombotic and then explain, it means inflammation and blood clotting. And the importance of that, because the inflammation, the swelling that occurs, is your immune system saying, wait a minute, we're infected, or there's something where it shouldn't be, and we need to destroy it. And chemicals are released, a wide variety of chemicals. Some are cytokines, some are interleukins, some are growth factors, there's a wide variety, all of which are designed to kill the cells. And then when the cells die, there's swelling or inflammation. But there's also that redness. You've seen it. You've gotten a sunburn. You were thinking, I had a sunburn because we've been out in the sun more recently here. That's the blood vessels responding. Now, they're doing 2 things. They're carrying more blood to the area to deal with the fact that you have to get your immune system there to go attack the problem. But there's also blood clotting occurring. And this is important for 2 reasons. If you have something coming into your body, a virus, for example, or if you have a cancer developing, as another example. In both instances, either the infection or the cancer is trying to grow. It needs more nutrients, it needs more blood, and it wants to spread. So by blood clotting, the thrombosis part, it's really starving by blocking the blood flow into an area. It's starving either the virus or it's starving the cancer. And by clotting around it, it prevents either the infection or the cancer from getting out. So we have really gotten to a point, I think, in 2023, and I'll take responsibility for just culling inflammation in 1994 with the theory, because, that's part of what I did. We dumbed it down. But, we have now forced everybody into looking at this infection and the genetic vaccines and the consequences of it. And so part of my job is to help people better understand what they need to know. And you don't have to come away with an A in the class or a degree, but you are smart enough. And you deserve to be treated like you're smart enough to explain it to you. And that's what we're going to do from here on out. It's inflammation and blood clotting, or an inflammatory thrombotic response. And every health problem that we see, heart disease, strokes, diabetes, high blood pressure, infections, cancers, you name it, are the result of this inflammation and blood clotting, this inflammatory thrombotic response. And your body will either bring it under control or it won't. And part of what we're going to do at the Vitamin C conference is help people understand what you can do to help bring these problems under control and to improve your overall health, so that you are living a healthier, longer life versus just living longer. And we've seen this. People spend most of their healthcare money in later years in life just to keep you alive. And to medicine's credit, what we've done is we've dealt with the emergency things that will kill you. That's kind of a priority. And once you start getting that type of thing under control, then you can go back and say, what have we learned about this that allows us to help people live longer, healthier lives, and to deal with these infections, these cancers, these heart attacks?
I know that some doctor colleague friends and myself, we like to explain it as living long and dying short. So the next question that I have, and again, if you could explain it to our listeners where, that they can understand it, because I think it's really important that they have a good understanding. But can you explain what prion disease is to our listeners?
Right. So prions are proteins that are abnormally folded, and because their shape has changed, they no longer work in the way that they're supposed to. But in addition to the shape change, what they do is when they come into contact, the abnormally folded proteins, the prions, come into contact with normal folded proteins, they can change that structure. It's kind of like, a fire. Now, and with Maui Lahaina undergoing what we're seeing, it's a good example. Once the spark is lit with the initial prions, it is very easy for that to spread and to engulf the rest of the body and to take and destroy the function of the rest of the body. And we've talked about diseases like mad cow disease, which is a prion disease. Its scientific term is spongiform, because the brain looks like a sponge. Spongiform encephalopathy. The brain looks like a sponge because these abnormal proteins, when we look at them under a microscope, cause the normal structure of the brain to look like a sponge. But it changes the function of the proteins, and it therefore causes disease. And some of the diseases that we're going to talk about that are associated with the SARS-CoV-2 viruses and the genetic vaccines and what's been going on are prion diseases of the brain, like Alzheimer's, like mad cow disease. I mean, Jakob-Creutzfeldt disease is the name, or Creutzfeldt-Jakob disease, depending upon who's pronouncing it and where they were trained at. I actually, as a student, had one of these patients when I was a medical student, which is very rare to see one of these. So you get to see it firsthand. But there's other diseases that are being missed. And one of those is amyloidosis of the heart. It's a certain type of protein abnormality where these proteins get into the heart and they cause a stiffness of the heart. So we call it a restrictive, because it's stiff, cardiomyopathy, because it's a heart muscle weakness, which is what cardiomyopathy means. And this is one of the reasons, but not the only reason, as you're going to find out when you come to the presentation, why these sudden cardiac deaths are occurring and who they're occurring in. But it's also happening in the pancreas, so diabetes is a problem. Anywhere there's proteins, anywhere in the body, an abnormal protein can cause normal proteins to become abnormal. And the fire is set and it spreads.
Okay, that makes sense. A follow-up question to that. So, with the brain coaching that I do, certified with the Amen clinics, would you categorize anxiety and depression and ADD into that prion disease? Because I know for me, I'm seeing a huge uptick in just those emotional behaviors.
Well, one of the things, and you're going to get to see this also, I think it's included, the Vitamin C conference is only about 40% of the material that I have for conferences that will be coming on down the line. And one of the things that has been seen is that the SARS-CoV-2 viruses themselves interfere with tyrosine hydroxylase, which is an enzyme that is needed in the brain to make dopamine. And so one of the reasons why, if you exercise, for example, we see people have a better attitude. They're less anxious. They're better able to deal with things. And of course, the lockdowns and shutting down the exercise didn't help with any of that. But we know that the viruses themselves interfere with this tyrosine hydroxylase, decreasing your dopamine level. And when that happens, people become more anxious and they become more depressed. So I wouldn't call it a prion disease because it's not an abnormal protein, but the enzymes that are necessary to make the dopamine, what's called a neurotransmitter. And by the way, I see your sodium ascorbate behind you there. Good job. That is depressed or reduced. And anytime you reduce the enzymes, which is what tyrosine hydroxylase is, you can't make as much of the product, right? And the product being dopamine is necessary for your mood, substantia nigra with the mood and behavior disorders. So you cut that down, you won't have to see prion diseases, but you're not going to have the same positive outlook or ability to deal with stress because your dopamine is suppressed.
Right. And I've noticed that there's a lot of people that have decreased endorphins just in light of everything going on. So the dopamine makes sense there. And
endorphins and enkephalins both are induced. You know that I'm a runner. I think I'm a runner. Endorphins and enkephalins are induced when you exercise, and that is part of that athletic high, that we get, that you want to exercise after you get used to it,
right,
because you get those chemicals released. And if you don't have that release of that, one of the ways that we know that acupuncture and acupressure works is that it actually releases those same chemicals. It's not just because somebody's sticking you with something. It's actually those chemicals are stimulated to be released, and therefore they control pain.
Right. I notice, there's a lot of clients that I work with who kind of get that runner's high when they're exercising. And so there's a lot of studies on exercise and actually helping to calm the emotional brain. So the next question that I have is, and it's twofold. So there's a part A and part B. So one is, what is cancer? And the follow-up to that is, why are we seeing such an uptick in cancer right now?
Yeah, so it depends upon my mood when I answer that question. I mean, cancer is kind of like teenagers or medical students and residents. They eat a lot and they consume a lot and they make a lot of noise, but they don't get a lot done. So cancers are really cells that have run amok. And I hear people argue about whether it's genetic or something like that. The reality is that everything that comes in to your body that is a carcinogen, a cancer-causing agent, has an impact on your DNA. It alters your DNA. Now, you can be born with a genetic abnormality that predisposes you. It won't give you cancer, but it will predispose it. It makes it easier. So BRCA1 and 2, which stands for breast, BR, CA cancer, gene 1 and 2. A good friend of mine, Lynch, who passed away during this pandemic, Henry was the man who actually discovered those genes. And if you have those genes, there's a 25% chance that you will develop breast cancer or ovarian cancer or uterine cancer, or if you're male, prostate cancer. There's also some GI cancers that occur with that. So it predisposes you. It makes it easier for your immune system to be tipped off. In reality, we're going to talk about 9 pathways that I will show you are well established on how these SARS viruses and these genetic vaccines are accelerating 9 different pathways. And again, this is not for people to come out of there and start being able to quote the pathways. I mean, that's what I do. And I don't expect, nor do you need to be able to do that. But I owe it to you, and you deserve to see that there are 9 pathways, that this isn't something imaginary or fictitious, that it's real, that it's established, that the research has been done. And it's important to know, because once you see those 9 pathways, then you see how the treatments fit into those pathways, including vitamin C. And one of the real problems that I see, I guess my clinician hat now going on, my MD hat going on versus my, for me, I don't split the PhD scientist away from the MD. They just don't disconnect. But clinically, the reality is many of the drugs that we use as physicians work better when vitamin C is added into it. So there's this disconnect out there because people, want to fall in one of 2 categories. Either we're going to do, all the vitamins and minerals, and we're not going to do the medications, or we're just going to do the medications and we're not going to do the vitamins and minerals. And the beauty of it is that it actually works together. And when it works together, the results, and you'll see some of these images, you'll see the microscopy slides, you'll see people that were not responding to treatment, respond to treatment, and that you can see it under the microscope. And with Fleming method, you can actually measure it. So, if you don't like people cutting pieces of you out and putting it under a microscope, there is a way to actually measure it. But it's the combination of putting everything together and being able to measure an improvement that is so critical. And these cancers are being launched for a variety of reasons. First off, there's the upfront honest reason, which is nobody was looking for 2 years, right? So anything that was growing, now we're seeing. I mean, you can't find something you don't look for. And then there's 9 pathways that are very obviously there. And we're going to talk about all 9, and I'm not going to release it beforehand, but you take a picture of the slides. I've shown it to you, and your eyes glaze over, and I get that. That's but that's part of my job, is to say, what do people really need to know? And for clinicians, what do they need to know so that when you come into them with a problem, they have a confidence level that is hard to match if you don't have the data. But once you see the data and you see the results and you understand why, you have a different level of confidence in treating people and reassuring people. And I think from a patient's point of view, when they come in to see their doctor and their doctor says, I know, Mrs. Jones, the classic patient, I know, Mrs. Jones, you have this problem. We've seen the results. We know this is one of the causes. We know these treatments work. We're going to monitor and make sure up front that we get the right thing for you that works. The patient leaves there with a different level of confidence. And when their friends ask them, well, what did the doctor tell you? Your response is different, right? Because you go, my doctor showed me or knew what they were talking about. They didn't just say, well, we're going to kind of treat this and try it and see if it works because we don't have anything better. They're going to do it with a confidence level that they deserve and you deserve.
Okay. I'm going to ask you a couple of questions before I get to the next question. What is apoptosis and how does it differ from autophagy?
So apoptosis is simply the death of something, and autophagy or autophagy, depending upon who's pronouncing it, means self-eating, right? So apoptosis means something dies. The cell just dies, right? Autophagy, or however you pronounced it, is your body tearing down damaged tissue and recycling it. For example, your red blood cells. Your red blood cells, when they are released from your bone marrow, represent 90% of the cells in your body. They are the only cells in your body that don't have nuclei. So what's the nuclei? Well, that's where your genetic code says, I can make another cell. Your red blood cells in your bone marrow, those precursors, those earlier cells, they have nuclei. But when the red blood cell is released into your bloodstream, it has 120 to 130 day lifespan. It's not going to reproduce itself. It's about 110, 120 in men and about 100 to 110 in women. Those are just the numbers, period. There's no XY chromosomes in there because there's no nucleus in there. And then it dies. And so your spleen, typically as the primary organ for that, will sequester. They will get together these red blood cells. They'll tear them apart. They'll recycle the iron. They'll recycle the hemoglobin parts, right? So that's autophagy. It's the body's mechanism of breaking down and recycling. But apoptosis means it died.
Is there one more prevalent when someone has cancer?
So, the reality is cancers, the growth of a cancer is determined by its blood supply, right? And and which is determined by the metabolites, the nutrients that it needs to survive. If it outstrips its blood supply, then it will start to die. And when those cells die, then they release calcium. So you and your listeners have probably heard, the doctor looked for calcium deposits, right? And that means cancer. No, it means calcium deposits. It might mean cancer. But, that calcium gets released. So when, I'm not sure exactly what your inference is in the question. If the cells outstrip their blood supply or food supply, they will just simply die. And that's just the process of apoptosis. Autophagy or autophagy, depending upon, again, who's pronouncing it, is that process where they are recycled. And everything's going to be broken down and recycled one way or the other. I explain this to people, sometimes people like to take these supplements that they think are going to go straight to a joint. And they don't. you digest it in your stomach, and all of the components of those drugs, whether they're, big pharma makes the quote natural stuff anyway. I mean, this isn't, some guy out there on the street making a product for you different than big pharma. Big pharma is the one making these other drugs anyway. But you digest it, and your stomach acids strip it down into its basic nutrients. And so the question becomes, well, how do those nutrients know to go to that joint and recollect? And the answer is they don't, which is why typically you have to inject something into a joint if you want to get it there. But, that breakdown product is true of just everything in the body. And, we just typically don't call it that with the nutrients we take, because autophagy typically means your cells are being broken down versus food, and that's called digestion, right?
Mm-hmm. Okay. All right. It's a good way to explain it, by the way. I love that. The next question
I wonder on something.
The next question is kind of two-part too. So one is, how does vitamin C help our immune system when it comes to disease? And the follow-up to that is, why is there so much controversy in big pharma, government, doctors not wanting to give high dose vitamin C when someone is ill?
Well, let's start with the second one. You can remind me what the first one was in just a second. I think part of the problem is people you've heard the expression, to a man with a hammer, everything looks like a nail, right? By the time you get through medical college, and you become an allopath, an MD, or you go to osteopathic program, you become a DL, you spend a tremendous amount of time learning what these drugs are that can be used to work on the body. And that tends to be where most people concentrate on. But I know when I was a medical student, we got the information about the vitamins, the minerals, fluids, the electrolytes. In fact, in the dark ages, when I was a medical student, we actually had to calculate for patients exactly how much of all the vitamins and minerals and carbohydrates and protein and fats and medium chain triglycerides and medium chain fats they would receive in a day or a week. We had to be able to do that for burn patients and surgery patients and you name it. Well, they don't really do that anymore. So unfortunately, in our training system, we get most of that in what's called biochemistry, because that's where it's at. That vitamin C, that sodium ascorbate molecule behind you is a biochemistry class level course, right? The problem is that if you don't extract that and take that with you into clinical practice, you may forget to apply it. And then we get into the perspective of, well, wait a minute. We kind of got into the treatment of patients, and these are the drugs we were told to give. And what about these other things? Is there a role for them? And that's, again, one of the reasons why I'm going into the depth that I'm going into in these presentations, to say, this data has been published. You may not see it. Big pharma doesn't make a lot of money by selling you vitamins and minerals, right?
True.
Come on. If chemotherapy costs $100,000 for 6 months, and there's a profit margin there, and you go to the store and see what they sell vitamin C for.
Can I just add to that? There's not only a profit margin in for big pharma, there's a profit margin in for the oncologists who are recommending, because there's kickbacks in that as well.
So I will.
And you don't have to comment on that.
Yeah, no, I can't say that there is, because, when I was a medical student, I was vice president and then president of Caduceus, the Medical Student Society. And we had big pharma come in and they provided $100 textbooks to us, which were monographs, right? And I had students complaining to me that we shouldn't be taking this from big pharma. And so I actually stood up in front of the class, 176 folks, and I said, look, if you're like me, these books are priceless. And they're thin. I mean, they weren't that, but they were great monographs. They explained the pathways. They explained things that you weren't going to be able to afford. But I got it. Look, $100. And I literally looked at my classmates and said, look, If you feel that you are going to be compromised by taking these books, then for the love of God, don't take them. But I also think it's really sad if you can be bought for $700. If you can be bought for $700, then I'm sorry, right? So are there people that can be bought for that? There are. Does everybody do that? No, they don't. So that's where I just kind of hit that roadblock. I can't tell you. I mean, I can tell you that there are people on this side of the equation that have gotten millions of dollars from big pharma, and people think they're great because they're arguing one side of an equation. But the reality is they've gotten more money from big pharma than most people I know of, right?
Right.
And there are other doctors like myself who've gotten nothing. Now, I did do research in the old days, and big pharma did pay substantial monies to the university. It didn't supplement my income, and I published the results one way or the other. So there are a variety of reasons for why there's problems, and in the end, you come down to how, an expression I tell my children: how you do anything is how you do everything. So if you are somebody who is bought at the least amount of things, you're going to be bought at the most. If you're somebody who's ethically going to go, I cannot be bought, you can attack me as much as you want, I am not for sale, I'm not rentable, I'm not, then you won't do it at the bigger things. But unfortunately, we know the human equation is there, whether it's in medicine or law or politics or building a home. We know that people can be bought, and unfortunately, it shouldn't exist. And a question that I always tell people is, don't come in and ask me who the best doctor of the hospital is. You ask me, the question to ask me is, if I had this problem, who would I go see? And that tells you something, because we have behind the scenes real information on what's going on.
Okay.
And you asked the first question, but I don't remember what the first question was.
The first question was,
why don't people use these? And I think that maybe I got that in there, which was because they just haven't put two and two together. And one of my jobs, and I take it extremely seriously, is to demand that the information and the presentations I provide are so spot on, so detailed, so research published and validated, that when I teach the doctors that are going to leave there, or I teach the patients, they know what to ask the doctors about, that you have that scientific basis, that it stares you in the face and says, when vitamin C in the right doses was added to the regimen of a chemotherapy drug, patients, you're going to see some of these slides and then you'll get what I'm talking about. Patients who weren't responding to the chemotherapy suddenly responded, because here's the first part of your question. What does vitamin C actually do for your immune system?
Correct.
Well, the only thing that vitamin C does not affect is antigen attachment. But the entire rest of your immune response is augmented by the right doses of vitamin C. So there's only one step in all of it that vitamin C does not have anything to do with, and that's attachment. Now I'll show you that slide at the conference for those of you that are there. For those of you who aren't, well, I guess you won't see it.
Okay. So just another follow-up to that. How important is it for someone? Because at the vitamin C conference, there's just going to be the average person also attending. Maybe they're just patients. Maybe they're other health practitioners that, aren't licensed, that are just doing it because they love to do it. But how important is it for someone to make sure that their doctors are educating them on the immune system? Because for the most part, the people that I work with, they don't even know about the immune system. Their doctors have never shared this. So how important is it?
Well, since it's what keeps you alive and helps you deal with infections and cancers, I think it's kind of important. The only thing more important than the immune system is the heart, of course, because the heart pumps the blood around the body. And so no pumping blood, you don't need to worry about an immune system, you'll be dead. But yeah, sadly enough, there is this perspective that challenging areas, whether it's in medicine or physics or you name it, are things that people try to avoid. And so you can there's two types of people. There are people that will look at the challenge and say, I want to know and understand it. I can do this. And there's the others that, basically want to treat it, for lack of a better example, like a vaccine. You take it, you don't have to worry about anything, right? That naive perspective, we used to have that old joke, but now it's probably not so funny for most people, where most students treat exams like vaccines. You take it, once you're done, you don't worry about it, right? Like you're immune, you don't have to remember anything. People have seen lots of folks, they take classes with you, they cram for the exam, but they never remember anything. Why? Because they didn't go in there with the intent of learning. They went in there with the express purpose of getting a grade, completing the course, and getting whatever piece of paper they wanted to at the end. And taking care of patients, while it is important to have one of those pieces of paper back up there, it's only significant if you take that knowledge with you. The number of times I have examined patients, and I do a full exam. I don't do prostate exams with guys. Look, there's other people to do that. I'm your cardiologist. If I'm doing a prostate exam, there's a real problem, I think. And the reality is, I have people all the time say, why did you listen to the arteries in my neck? Why did you check the pulses in my feet? And my response is, I'm sorry, every doctor should be doing that. Why did I look in your eyes? Because it's the only place in your body that I can see arterioles, that smaller size blood vessel. There's no other place I can see that unless I cut into your body. And by looking in your eyes with my ophthalmoscope, I can see whether you have a diabetic problem, a high blood pressure problem. I can see if you've got detached retinas, whether you've had laser surgery. I can see whether you have cholesterol plaques called Hollenhorst plaques. I can see if you have papilledema, elevated pressure, although that's a late sign by the time you're looking there. Why do I do it? Because it's part of what I was trained to do. And you came to me as a physician to do that exam. You should expect, and your doctor should expect to deliver to you the highest quality healthcare possible, no matter who you are, no matter how much money you have, period. That oath that we took, that either Hippocratic oath, if that's the one you took, or our class took the Geneva oath, because we voted on it, and I voted Hippocratic, but I lost, so we took the Geneva oath. Neither one of those say do no harm, but they both emphasize two groups of people that we owe an obligation to. The first one is the group of people who taught us. We owe them a debt, and we are indebted to them for life and to their children and their families. It's in the oaths. Number two, our patients. Our patients are the ones we accept. You wanting to come to me doesn't mean I accept you, right? If I say you are my patient, now I have established a bond, an oath. And that oath, while the Geneva oath came after Geneva from World War II, the oath that's attached to the Hippocratic oath is thousands of years old, which means it predates the United States, the laws of the United States, the legal system of the United States, and every other bloody country on this planet. That oath precedes all oaths, and it is, whether people like this word or not, a sacred oath. And if you don't think so, You should have been there to see my parents' eyes when I took it.
Well said. So the next question I have, and it's kind of a two-part question again. You mentioned, first of all, about calcium. So I want to ask you to explain oxidative stress and if the calcium channel has anything to do with what we're seeing with heart issues.
Okay, so that diagram right up there. That's the original diagram that I presented at American Heart in 1994 for the inflammation and heart disease or inflammothrombotic response. And in it is clearly calcium. In it is clearly oxidative free radicals, right? In fact, the pathways are in that figure, which is probably why they dumbed it down for the textbook, right? Because it was too complicated. They wanted something simpler. And I thought they did a pretty good job. So I'll give it to them. But this is the better explanation. So, your body deals with shifts. It has what's called homeostasis. It wants to maintain a balance. And part of the challenge for physicians, patients too, but physicians, is to balance the system, not to perturb it too much. There was a drug called Hirudin that I did research on when I was a cardiology fellow, and it's the active ingredient in leech venom, right? And believe it or not, when I was a cardiology fellow, we had people with peripheral vascular disease that we attached leeches onto them. And then part of our job was every 24 hours, we would take the leeches off and put new leeches on. But you could also get too much Hirudin, glamorous job, right? You could also get too much Hirudin into somebody. And we were using it because it reduces blood clotting. So, part of the final insult that causes myocardial infarctions or heart damage. Myocardial infarction means heart damage. Typically, people refer to it as a heart attack, but they're two different things. When you have that heart damage, it's because there's a blood clot. Hirudin helps to dissolve that. And I remember the first time we used Hirudin in a patient, and I came in to make rounds in the morning, and the nurses had let the guy shave, and he looked like somebody had taken a machete to his face. And so we changed the protocol. Men could no longer shave, and ladies, please don't either, after you get Hirudin. Because of the risk of bleeding, and we kind of at the time said, well, Mrs. Jones, good news, bad news. Your husband didn't die from the MI, but he died because he bled to death because of the Hirudin. So you have to balance what you put in the body. You can't perturb it too much. Well, that homeostasis is applicable for oxidative free radicals, for pH in the body, for calcium release in the body. It all has to be in balance. You tip it one way or the other. You put too much stress on the system and you'll break it. Or the body will react the opposite way and cause the exact opposite reaction that you want. So part of the balance of learning to be a good physician is to learn how to treat somebody without pushing it so much that you cause a problem. Vitamin C has this same issue pop up with oxidative free radicals. And there's a lot of misinformation about vitamin C. And when you really go look at, and I talked to Laurie in charge of this conference on some of the articles that she was looking at, there were people that were saying too much vitamin C could be a problem. And in reality, the published research showed just the opposite. But you can cause problems with too much of anything, which is why you have to have a physician treating you responsible. This is not a cookie cutter process where you're going to go to the conference and you're going to go, you give this amount. Even the prescription drugs we do, you have to figure out what dose works for the patient to get the effect without the bad consequence. Oxidative free radicals, same problem. They're there, obviously, as a result of tissue damage occurring as these cells are broken down, as we talked about apoptosis. those oxidative free radicals leak out and they can cause more problem. And your body is designed to pick up those oxidative free radicals so they don't cause more damage. A good perspective, two good perspectives. One is hydrogen peroxide. If you put that on something and you see the bubbling, that is the oxygen coming out of H2O2. But the way it does that is H2O2, hydrogen peroxide, gets broken down into water, H2O, and a free oxygen, an oxidative free radical. When two of those get together, they form the oxygen O2 molecule, and you see bubbles coming up, right? Oxygen bubbles. But it's that oxidative free radical by itself that is extremely toxic. Vitamin C and other things that we give to people are oxidative free radical scavengers. They help to complex with it, take it out of the system so it doesn't cause harm to the person.
Nicely put. So you say oxidative free radicals.
Right.
Is that the same thing as oxidative stress?
So when the term oxidative stress is used, it means that something is happening to the body, a stress, that may produce oxidative free radicals. It doesn't mean it will, but it has the potential for doing that. The other nice example of oxidative free radicals or oxidation that I wanted to mention was you take an apple, you slice through it, you leave it out in the air, it turns brown. What's that brown color? That's oxidation occurring to the apple. Okay, that's the other example.
An analogy. I like it.
That's actually what happens inside the arteries of the heart when we're talking about this inflammatory thrombotic response, which is why those oxidative free radicals are in that figure up there behind the scene, because that is also part of the damage occurring in the arteries of the heart.
Okay. What is the role of natural killer cells?
To get the medical students to do their job. So a natural killer cell, so you really have two basic immune systems. We all have what's called the innate. All animals have what's called the innate, INNATE system.
The one we're born with.
So every animal species has that.
Yes.
Okay. And those are called T cells because they originally come from the thymus, a gland in the middle of your chest. And we could probably spend a good hour talking about that and the information and misinformation that's out there on that. Higher animal species like humans have another layer on top of that called the adaptive or humoral, also known as the antibody system, right? So the innate kicks in right away, usually 2 to 3 days, and antibodies kick in at about 7 to 10 days. Those are B cells, which originally come from, they originally discovered in fowl. They stand for BURSA, B-U-R-S-A in animals, and they come from the bone marrow in people. So B works for both. And then we have natural killer cells. Natural killer cells are a cross between the two. They belong to both, and yet neither completely to either the innate or the adaptive system. They are unique. And their unique characteristic is that they do not depend upon some of the signals that the innate system depends upon. So a virus can get into a cell and cloak the cell, if you will, using a Star Trek term or Star Wars term or whichever one of the fantasy terms you want. I don't think you watch either one, so you're completely clueless on what I'm talking about on this, but they make it go invisible, right? And it changes the receptors. But natural killer cells don't depend upon that. They depend upon other factors. And so natural killer cells go after things, go after the cancers that are being hidden by viruses that have gotten into cells. And we know that viruses can cause cancer. In fact, we used to call these oncoviruses.
Right.
And we know that the genes that are within that your genetic code that cause cancers are called oncogenes. And we know that these viruses can stimulate these oncogenes, right? But natural killer cells, by and large, can find them. In fact, when I was a medical student, we were told that every human being develops a new cancer cell inside their body every day of their life. But your natural killer cells find those, recognize those, kill them, destroy them, rip them apart. That's part of their job. There are about 40 different types of problems that exist for natural killer cells that we know that exist in human beings where their natural killer cells, also abbreviated N for natural, K for killer, don't work in people. And when those don't work, there are a wide variety of infections that occur. When I was a medical student, again, I took care of a little kid that had one of these abnormalities and had a glycoprotein 120 abnormality. And this little baby had only been out of the hospital maybe 2 to 3 months of its life. And, you know, when we were medical students, we used to, I don't think they can do anything to us now. There were about 10 of us that had gone through the rotation and taken care of this little kid and was basically a bubble baby and desperately needed white blood cells that did work, that had natural killer cells to deal with infections. And so unbeknown to the faculty, there were about 10 of us who went down to Boyd Blood Bank because the University of Iowa happened to be the place that most blood banking information came from in the United States. The Boyd brothers came from Chicago and set up housekeeping at the University of Iowa. And Iowa made it possible to learn how to preserve blood so it wouldn't break down. So the Boyd Blood Bank was one of the top labs in the country, and about 10 of us would go down there every few weeks and donate our blood. We'd go in there for about 4 hours and have 2 massive 14 gauge needles, one in each arm, and it was very cold. Actually, it's the thing that we remember most painful and cold. For about 4 hours, and we'd let them centrifuge off our white blood cells, and then those cells were donated to that little baby.
Oh my gosh. Wow. Wow. Pretty admirable. I love that story. There are many types of vitamin C that you're going to talk about and that people are aware of, people like me. There's the liposomal, which kind of sort of seems like all the rage. Everybody's talking about it, including Dr. Levy, who we know is not correct on that. There's ascorbate, there's potassium ascorbate, and there's sodium ascorbate, which really is what Pure C, Lior, who is hosting one of the only vitamin C conferences that I'm aware of in the US, maybe even the world. But what is the difference between these vitamin C type of molecules, and which I know which one you prefer, but can you just tell our listeners the reason you prefer the ones that you're going to be talking about?
So, probably the major reason for the reality is sodium ascorbate has some very decent data that's already been published on it. And that's compelling because it's one thing to say you have something that works, and it's another thing to show that what you're saying translates into something meaningful. Sodium ascorbate, again, you're going to see some examples where this was given to patients in addition to other treatments that were being given. And as a result, their cancers started responding, right? So again, you can either determine tissue data by taking the tissue out and looking at it under a microscope and hoping everybody agrees because it's a visual thing, or measuring it with Fleming method, which is another way of doing it. Outside of that, you're not really able to measure it. So liposomal vitamin C is just a fascinating concept to me because vitamin C is a water-soluble vitamin, right? I mean, there's only 4 fat-soluble vitamins. It's vitamin A, K, E, and D. So fat, A, K, E, D, faked, okay? This is the acronym we were taught way back in the dark ages. And everything else is water-soluble. So why would you take a water-soluble vitamin and wrap it inside of a lipid layer, the same type of things that's being used for the genetic vaccines? Why would you do that? Why would you take something that has to be absorbed aqueously, water, and wrap it in a fat and then give it to somebody? So mentally, for me as a scientist, that's a disconnect. You know, you can make a great argument for vitamins A, K, E, D doing that, right? Because they're fat soluble. But you wouldn't take something that's water soluble and then wrap it in something that prevents it from being absorbed. The arguments that are made is that, wow, it has a great uptake. Yeah, it does. But does that translate into a better treatment response? And there is no data to show that. None, right? So if you really want to encourage a vitamin or any substance to be taken up, you minimize the interference with its natural process of being taken up. And again, taking something that's water soluble and wrapping it in a fat is a big disconnect. Let's just put it that way. There is no data that it provides a better clinical outcome. It is more expensive. I have tasted it, other than the fact that I think it's disgusting as a taste, which is not a scientific argument. It's just, I'll die before I'll drink it. Is probably not a scientific argument either. But so there's no data to support its use. I haven't seen it being done with any clinical studies. I see this a lot with people who want to promote something and then they get stuck into the scenario of somebody saying, well, let's do research and see whether it does or not. And that research never materializes. Well, why? If you firmly believe that your product was that outstanding, you would want to prove it. I know this is now my 55th or 56th year, one of the others, of doing research. And one of the major lessons that you learn early on, hopefully, is that much of your research doesn't pan out. You find out, you start doing something and the results don't match what you thought they should. And a real good researcher, in my opinion, looks at that data and says, what is the data trying to tell me? Here's my teacher. My real world teacher is trying to teach me something. I've done what I thought I should do. These are the results. What am I missing? What's the message I'm supposed to learn? And that's where the real science takes you. That's when you start to make discoveries. There's always this thing about how did they get there? And when you actually talk to the people who do the research, you find out we never have a straight line path. And we always have these moments that what I call aha moments, where, and if you want to know if somebody actually did something, you ask them what their aha moment was. Because that aha moment is when you think, how could I have been so stupid to have not recognized this earlier? It's so blatantly clear, my aha moment, right? That's an aha moment. I mean, it did take a little while to draw it out, but it is so blatantly clear that you look at yourself and wonder how you could have been so stupid as to not understand what was being told to you scientifically, right? And if you follow that science, you will discover more often than not that you get doors of communication open to you that you otherwise would not have had the intelligence to ask the question to, and you follow that and you learn things. Well, when you talk to the people who do the research, they will give you those stories. But if you talk to people that don't do the research, they will tell you, we don't need to do that because we know this is right. That doesn't happen. More often than not, that does not happen. You learn from the science. You learn from the mistakes. All the patients that, in my early training who somehow tolerated what I did to them so that I would become better, taught me, I have this old case. I know this is off track, but I have this old case where I was a second-year resident on a cardiology rotation, and there was this patient who came in to me with a blood pressure medicine that was a combination of 3 drugs. I thought, oh my God, this is archaic. I'm going to switch him over. I'm gonna put him on a new modern drug. Okay, and I won't tell you which one because I'm not going to bash drugs this way. But so we made rounds, and the attending cardiologist, very good, Dr. Booth, by Dr. Richard Booth, Creighton University, looked at me and he says, well, Fleming, get the blood pressure under control. So we did this 3 days in a row, and I kept upping the drug. And every day he'd look at me and he'd go, Fleming, get the blood pressure under control. On the 4th day, when we made rounds, that patient's blood pressure was spot on. It was under perfect control. And he looked at me and he said, what'd you do? And I said, put him back on his old drug.
Wow.
Even though it was a 4 times a day combination of 3 drugs that I thought was archaic, the bloody drug worked for this guy. And the message that the man was trying to teach me, that I learned, was when you have a medication that is working for a patient, don't change their medicine because there's a new and improved that's out there. That person is getting the end result you want, which is effective treatment, and it doesn't get better than effective.
Nice way to put that. So as we start to wrap this up, I have a couple more questions before I want you to explain how someone can learn more about the work. If somebody gets COVID, is vitamin C more effective via an IV treatment? And I know that Lior is going to talk about the therapeutic doses of her pure C, vitamin C, which that's what I take. I love it. I know it works. But is it more effective via IV or therapeutic doses that somebody can just do themselves at home, providing they have the correct therapeutic dose?
Right. So I'm not aware of any research that's been studied with the viruses and COVID as a disease, coronavirus disease. So I'm not aware of any research that's been done that's compared oral dosing with IV dosing. I will tell you that in the national clinical trial that I did, the research that was done was with IV, because you've got an IV in, I'm going to give you everything IV that we have IV. Because it bypasses what's called biodistribution issues, which is how much of it will get absorbed. But by the same token, absent information, so nobody knows for certain, right? There's no reason to believe that people cannot get adequate oral doses if they're getting enough orally. And so, again, your skin has some important functions. One is to keep everything out that's out and everything in that's in, right? That's one of its functions. And so when you put holes in the skin, you automatically open a pathway, right? So I always tell people every time I put an IV in or I do a cardiac cath, one of the complications is infection and bleeding, and I'm doing my very best with it. But when you do that, there's a risk of that. So I encourage people not to volunteer their body for anything they don't need to. But if you need to, then of course do it with people that are competent, that are taking your best interest and doing it the way that it's supposed to be done. So no research that I'm aware of that compares the two.
Okay. And the last question I have for you is, why is it important for health practitioners to attend this upcoming vitamin C conference? Because again, it's the only one that I know in the US and maybe the world. I mean, Leore's been putting them on now for several years. But why is it important for someone like a health practitioner, an oncologist, someone who's wanting to learn more about vitamin C to attend this conference? Because I know there are other speakers. And so can you explain that to an audience of doctors, health practitioners that may be listening to this?
Right. So I would like to say, at least from my perspective, you're going to be learning the pathways that you need to understand so that when you get to the point of why is this a problem and what are the treatments, you understand there's a real science behind it and you have that confidence level to deal with patients and to prescribe for patients, that you're not getting this perspective of somebody says it works because they think it works, and well, not as many people might have died. You know, that people might not have died because they weren't going to die or despite what you're doing. So it's important for them to have the science and the basis and the information. And I would say from some of the other people that I know that are going to be there, they're attempting to do that very same thing. They're trying to give you some scientific basis to support what they're telling you versus just simply saying, I'm telling you this, so you should take my word for it. I never presume that anybody takes my word for something just simply because I said it. I have 3 children, they're grown. I am not used to anybody taking my word for it just because I say it. I think you need to have information to back up and support what you're doing. And I know, you know, I've listened to Laurie a little bit, and he and I have great conversations behind the scenes about a large number of topics. But, you know, his slides, what I've seen of his discussions, he's trying to present to you the science behind what he's doing. I think the same thing's true of the other people. And if, you know, I've seen a lot of the different conferences. And if you're going to a conference just to have somebody tell you do X, Y, and Z, but you don't want to understand it, you're going to come out with a recipe book, which is great if you're making soup, I suppose. With the family and food industry, you wouldn't think I'd say something like that, but you know, you have to learn why the soup needs to be changed. Maybe why you need one ingredient more than the other at certain times and what to look for. You know, you need to do more than just run a standard restaurant. You need to understand why you're doing what you're doing. And you need to, I would argue, have the ability to go to your patients, look them in the eye, and have them know that you know what you're talking about so that they have that reassurance, not only that you're not just winging it, there's science and you've got their best interest at heart and you're going to follow up with them. Otherwise, you know, you're doing a disservice to your patients and your patients will know it. And I think most people that are really trying to deal with these types of health problems really do have an interest in providing the best healthcare possible, whether it's an infectious disease doctor, whether it's an oncologist, whether it's a cardiologist, whether it's a pulmonary doctor, whether it's OB-GYN. I mean, we're going to talk about why the spontaneous abortions are occurring. And we're going to talk about why the sudden cardiac deaths are occurring. And it's not anything you've heard. I know because I listen. And to have that type of information and to have it with the level of assurance that you will have it allows you to respond much better, not only for your patients, but I would also say when you get challenged, if the legal system's going to come after you, or whatever part of the system is going to come after you, if you can sit there and go, you might want to look at this research and then ask me again if I'm confident about why there's a problem. Right here, published research showing why these abortions are happening, why these sudden cardiac deaths are happening, why these cancers are happening, and what we can do about it. And after you read that research, then you can come back and ask me that question, or more appropriately, just come back and say, thank you, doctor, for actually being one.
I like that. Okay, one last question, and this is just perplexing to me. I just don't understand that. So you have people that have cancer and they go into their oncologist. And when they come out to check out, pay their bill, whatever it is, set up their next appointment, there's always a bowl of candy and chocolate and suckers. And I've been to the doctor with several of my friends that have had cancer. Why is that? Can you comment on that? Because I don't understand that.
You know, so let me give you a good example. When I was a cardiology fellow and I was doing the CCU rotation, the coronary care unit at the university, the nurses informed me on Saturday morning when I came in that I was supposed to bring rolls and donuts in, that every cardiology fellow did that. And I was just aghast because, as you can imagine, somebody giving me an order doesn't go over well, number one. Number two, bringing them garbage seemed pretty stupid. So I actually said, you know what? While I'm offended by you telling me that I must bring you food, since I'm not your dad or your husband, I will bring in a fruit platter, good fruit, which you should just say thank you for, and do that. And I brought that in, and the look of shock on their faces was, you've got to be kidding. Have you, the lack of appreciation there was palpable for me, right? Because I think this costs like $20 for me to bring it in. It's like, I'm a cardiology fellow. I'm not, making big dollars here. $26,000 a year, I think, is what I got paid. And that was, in those days, considered to be, you're doing really good as a fellow, right? A junior attending. The problem is we have placated it, and it's like dentist's office. You go there and they have candy for kids, right? Right? Yes. Dentist office, and they have candy for kids after they berate you for letting your children eat candy. And in Halloween, if you hand out good food, you're the bad neighbor because you're not handing out candy. We have a society that is so addicted to eating garbage, and then we want to know why we have health problems. Here's the answer, folks. Anything you put into your body has a consequence on your body, right? And it doesn't matter whether it's garbage food, and we're going to talk about that at the conference, or garbage anything else. Anything you put into your body, you are going to have a consequence on. And if you put good things into your body, you should expect a good consequence. And it's like so I ran one of the top 4 rat labs in the world for a year of my life, a genetics lab. And one of the things they taught us was how to get the rat to bar press, right? And you could get the rat to bar press for anything if you just gave it the treat that it wanted. So when you're walking out, maybe your question should be, am I just bar pressing, thinking I'm going to get the result I want because I'm bar pressing and I'm getting my treat as I'm leaving the office?
Okay.
didn't think that would be the answer.
No, but I like it. I mean, food, food is medicine, food is poison. Hence
Yep.
my website, StopSprayingGlyphosate.com, Big AG, farmer spraying Roundup, glufosinate, 2,4-D, all the other toxic chemicals, herbicides, pesticides that families just don't know about, and they're feeding them to their children. So Dr. Fleming, where can our audience find more about you? And I know, and then just tell us your websites so that they can look into that.
So there's really two places to look. One is the 10letters.org campaign. So the number 10 followed by the word letters, letters.org. And that's our campaign to get governors and attorney generals involved in helping to criminally indict these people responsible for what's been happening for the last, this is 8 plus 36 of 44 months going on 45, to help deal with these problems, where the general public can go on, fill out their cover letter, send that and the indictment letter into the governor and attorney general. So if you want to be actively involved, you want to say that you participated in trying to make a difference, this is your opportunity to do so. Kind of like being, I guess, marriage vows, if not forever hold your peace, and deal with the responsibilities or consequences of it. The other one is FlemingMethod.com. Fleming only has one M, no stuttering. FlemingMethod, one word, just put it all together.com. That's a website where I've got way too much stuff that I've put on over the years, because I never wanted to develop a website, but it has a lot of things about the viruses. It has information about Fleming method, how we can actually measure things, because we've used it for heart disease. We've used it for cancer. We can find out what's going on sooner. We've used it for these viral infections, for COVID-19, and to measure whether the treatments actually worked or not. So those would be the two places. You can find me on Twitter at Dr_I_M_the, because of somebody who harassed me, always calling me Doctor Who. So I just took that on. I am the doctor, just to harass them a little bit. I don't know. I don't have other websites. That's more than enough. I'm on Facebook, but you don't need to look me up on Facebook.
Yes. Okay. Well, for those of you who are interested, I have to tell you, the conference is an inexpensive way for you to not only learn how vitamin C works in the cancer and the COVID world, but you'll be listening to other doctors present on and educating you on the importance of vitamin C. You're not going to find something like that under one roof in 2 days. Plus, then you get to obviously go out with the dinner cruise with the other doctors and Dr. Fleming. But you can find more out about Lior's Vitamin C Conference at www.vcici.org/conference/. And we will be posting this podcast soon. So Dr. Fleming, thank you. I'm very grateful. And I'm very grateful for the very simple explanations, because I think it's important for not only the medical side of this for people to understand, but for those average people who are also going to be joining you at the Vitamin C Conference in Clearwater in September. So thank you very much, sir. I appreciate it, and have a wonderful day.
You too. Thank you.